Okay, great. All right. Thanks again for joining us, everyone. So we're really excited for this change to the new Human Services Partnership. I know it's been a long time coming. This is replacing coordinated funding and right now represents Washtenaw County, the City of Ann Arbor, and the Washtenaw Urban County as the three funders who are part of the partnership. Overall, we've talked a bit about this, that we are looking at three different types of funding rounds. And today we're really focused on the safety net funding round, but I'm going to provide some context to the partnership overall. So today I'll be running through the background, really the details on the safety net grants and eligibility, some of the submission requirements, including kind of how it looks and found it. So for those of you who haven't used it before, have a sense of what will be expected in doing the application in that portal. We'll talk a little bit about our expectations of grantees, especially related to sort of evaluation outcomes. That's something that's very different in the new Human Services Partnership. We'll be using an outside evaluator, which is exciting, but very different. So we want to talk about what that means, and then have a lot of times for questions and next steps at the end. So we'll go on to the next slide. So as I mentioned, so this is a change, right? The new Human Services Partnership, and really we, in sort of kind of reinventing what we want to do around human services from the county and the city's perspective, we wanted to put much more of a focus on addressing racism, poverty, and trauma as root causes of inequity. And we want to do that through a number of different ways. One, we're offering multiple funding rounds, and there's different goals within the funding round. Safety net is the first of three we're planning to do this year. There'll be another one this summer around mini grants and another one this fall for high impact grants. I will mention that now because if you're not eligible here, it's likely you could be eligible in one of the other funding rounds. We are going to be engaging community reviewers for all of the funding rounds much more extensively than in the past. Some of you may have seen that request for community reviewers that just went out this week. We can talk more about that a little bit later as well. We're also trying to infuse equity throughout the process, including supporting any of our grantee partners with equity assessments with an outside evaluator. So it wouldn't be with OCD or the county or the city of Ann Arbor, but with a third party that would assist around an equity self-assessment and goal setting that's done by the agency. So not where we're reviewing how people are doing around equity and DEI, but that it enables and supports each agency in doing that and coming up with a plan for what fits their agency and the populations they work with. We want to increase the accessibility to as much as we possibly can, both for you and for us, by simplifying the application, and also in other funding rounds in particular, making the process even more simple, so that if you're a new or growing organization, you don't have a dedicated person or people that can assist with grant writing, that it's pretty easy to navigate the process. And then one of our goals, because some of these funding rounds are for 5 years, is that there's still some ability to be able to react and be flexible and pivot for emerging needs as possible. So that's going to be something we learn as we go. And I think that's another piece of this, is that we're expecting that this will be adaptable and that there will be changes that occur as we continue to learn through the new model. So as I mentioned, there's 3 grant opportunities overall in the new Human Services Partnership. The safety net grant rounds right now, we're intending to be 5-year grants. Obviously you're here because the RFP is open now. And it's really focused on folks who are currently operating in those safety net areas and really are either system-wide service providers or connected to the system and supporting it in a significant way. These grants are $200,000 to $300,000 a year, or expected to be, for 5 years. So we are looking for sort of folks that are really integrated and engaged, or one of the main system providers in this particular funding round. For the 1-year mini grants, we're looking to do that process this summer. There it's a totally different focus, still focused on addressing poverty, racism, trauma, but really we're open to things that could be more high risk, high reward, new ideas that just we've never had the funding or the ability to try them out, but think that they could be very impactful. Could be a non-traditional group or a new agency that comes to the table that's never been served before. So that one is meant to be a lot more open and hopefully creative and innovative. And then the third funding round, which we're looking to do this fall winter, is the high impact grants. And here we're looking for real, real outcomes and potentially systems change, experience agencies. Maybe there is a complementary service that's needed that you haven't been able to fund that would make a huge change in the lives of the households you serve. Could be scaling a wider kind of group of folks that would benefit from a program that's already very successful. But those are really intended. There will be a really high expectation on those grants that will see outcomes, but we're also going to be, because we have that high expectation, baking in additional time for planning as part of that process in the first year, some strategic planning, and then a scaling up over the course of the 5 years. So there'll be a lot more information when we get closer to those grant time, but I just want to sort of lay that out for you and your thinking. Again, if this one isn't the perfect fit for you, there might be another opportunity that comes up in one of these future funding rounds as well. So I just want you to be aware so you can be thinking ahead. So now we're going to talk specifically about this funding round for the safety net grants. In this case, we're talking really only 4 areas of the safety net. I understand that we could define the safety net more broadly, but the city and the county leadership team did focus on these 4 key areas: the emergency food system, housing and homelessness, health and basic medical needs, and childcare. So very specific areas. The next slide, you probably saw this in the proposal, the request for proposal documents. And I just a caveat, like while we listed some of these as options, if there's, it says it could include, so there could be something else that we're missing, but it would have to be in these 4 areas. So in the emergency food system, it could be a food pantry network, a home delivered meal sort of broader system, mass food distribution, including food warehousing and supply chain for the emergency food system. Those are just some examples that would fall within the emergency food system as examples. In housing and homelessness, to really support around the homeless system of care, could be permanent supportive housing, rapid rehousing services, sheltering or short-term or transitional housing, related case management, but really with an emphasis on supporting individuals and families with services to improve housing stability and case management. So those are some of the areas that we would love to see within that homelessness system. Again, there could be something else that we haven't thought of, and we welcome it, but really specifically safety net services in these categories. The next one is health and basic medical needs. So this some combination or inclusion of payment for medical bills for uninsured or underinsured low income clients. This could also be, actual, funding for the low income healthcare providers or clinics providing medical, dental, mental health care. Or medical case management, and there could be some combination of the 3 as well. Could be in a location, it could be a mobile service, it could be any of those things. And I should say that we are looking for this to be a lot of really very low income folks, probably at or below the poverty line. There's some questions about the demographics to be served. So just again, since we're talking safety net, it's not on the prevention side, it is trying to catch people from things getting worse. So just to be clear on that. The last one is childcare. And in here, we're looking for its potential for childcare scholarships for low-income households or childcare provision, again, for low or very low-income households. So those are the main 4 categories that we're looking to fund with this particular round. Let's go to the next slide. As I mentioned earlier, these are intended for organizations that are currently delivering some of these system-wide safety net services in one of the 4 categories we just went through. We want those organizations to be serving residents at or below the poverty line. It's possible you could be serving people slightly above that, of course. Maybe some of you have grants for 150% or 250% of federal poverty level or various different things, but just want to make sure that we are serving folks really at or below poverty line for certain. The awards are intended to be 5-year grants, and right now we're planning for those to be around $200,000 to $300,000 annually to an agency. and they're not program specific. This is meant to be operating support for agencies delivering these safety net services. We do ask that the agencies or groups be 501c3 organizations or be submitting with a fiscal agent who is a 501c3. I know that folks have previously who haven't had the status have been able to partner with another nonprofit to gain that status. If you have questions on who might be a good fit or a possible partner, feel free to reach out and we can offer you some suggestions on who to follow up with. Next slide. Getting into the nitty gritty on the submission requirements. Actually, maybe I should pause there. Do you want to see if there's any questions just about the safety net category overall before we go into the submission requirements? Any questions right now?
Yes.
Okay, yes.
So when I'm looking at the summaries in terms of who would be eligible, and I think this is a follow-up question, but I'm imagining there might be other organizations like Peace Neighborhood Center who our entire population is very low income and people of color. But we work with individual youth, adults and families through a range of different services that hit different categories, but not any one that's comprehensive that fits within any one of those categories. Is there room for agencies like Peace to apply to this round of funding?
So I think so. I think if I hearing you correctly, you're saying that Peace would be providing services throughout. I think
so we're not a healthcare provider.
Correct.
We don't provide childcare per se during the school day, unless during the last 2 years, we were the ones who hosted kids in person for remote learning. We pivot all the time. We are not necessarily, of course, we participate in the food distribution system with food gatherers and have hot meals with every program we have, but someone wouldn't look at us and say that we are steeped in hunger relief per se, the way food gatherers is.
All right, Suzanne, I think you helped me with that. So thank you. I would say probably not then. I would think that because you would not be sort of one of the main providers of these safety net services, even though obviously you are connecting people to them, right? Through, like you said, your hot meal program, some of the other things. I think that probably for someone like Peace, the high impact grant round would probably be a better fit because it would be you could look at some sort of programming or supports or some sort of, I don't know what yet, but something that could really move some of those families to the next level with some really explicit outcomes for them. So I would suggest that based on kind of your description right now, and if it's helpful to talk more, we can. I think it would likely be a better fit in the high impact round. I'm going to talk about the funding available at the end. So I'm going to hold off on that question. I saw that pop up into the chat. So we'll just hold on to that for a second. There was a similar question about organizations applying more than funding round. I think maybe you would have to ask me a little bit more about that, because again, I think we're looking for people who are steeped into the safety net. So if you're, I guess maybe we can talk more. I see that question from Afifa Khan. So maybe you can ask me a little bit more about that.
Hi, yeah, I'm just wondering if you apply for the whole organization and all the programs that you're doing, if they can, if our nonprofit is doing different programs that are in different categories, do we apply all together, or are they kind of separate applications?
So I guess what I would ask back is if you are delivering services in the safety net categories that are safe or kind of system wide, like a broader supports, or are you within a system are providing I don't know, within the homelessness system, are you one of the main providers of rapid housing, for example? That would be an eligibility. I don't totally know, but I guess those are some of the things that we would be looking for to see. Let's see. A couple more questions here in the chat, and then I'll keep going. So I think similar to these kind of thought, okay, if you're a department of a government agency and if not a 501c3, can you apply? Sean, who are you connected with?
Sorry, had to unmute. Community mental health.
That's a great question. I don't know that we were foreseeing other government departments on there, so I'm going to make a note, get back to you, Sean. I would say that it would depend maybe on the service, and if there's funding available, like I don't know if it was a millage dollars would cover whatever programming you do, because I'm not sure what you're doing. If there's other funding that's available, I think likely we would probably divert to that other funding within Washtenaw County government. A little bit different for others, so maybe we can have that conversation, but thanks for bringing that up, and we can loop around and try and get that asked and answered.
Thank you.
The next one I see is, are the grantees expected to serve the entire county, or can they be limited to smaller service areas? That's a great question. I think I think the best way of describing it is, if you are providing within a specific geography some of these safety net services and no one else is a provider, I would consider you part of the safety net for that geography. If you're providing a category of services, if you're one of the few dental service, low-income dental providers that cover a large range, that might be one. I'm just picking sort of examples out of the 4 categories. I think one of the tricks, I will just be honest with you, is I'm going to do my best to sort of clarify some of these systems things, and then there will be community reviewers that are going to be also grappling with these same questions. So I think there's going to be one of the questions we'll get to in just a moment is sort of, how do you define your role within the safety net? And I think that's going to be a very key one for this application and the funding round, is to be as clear as you can as sort of your agency's role in that particular safety net sort of delivery of services, and who it impacts, and why it's fundamental. So if that's helpful, trying to figure out how to orient your agency within that is probably one of the best things. I'm going to hold off on a couple more of these questions because I think it might be good to go through a little bit more of the slide deck, but we'll come back to them for sure. So in the submission requirements that you're seeing here on the screen, sorry, I just kind of left it here. And we're going to show you a few of the screenshots from Found It where you'll be entering in this information, just so you can get comfortable with sort of what you'd be stepping through at the point you'd be doing an application. So if you're as a nonprofit agency, you'd be uploading your 501c3 status, an organizational chart, any grant monitorings that you may have received from state, federal, or local monitorings related to previous grants, those sorts of things. Several of those are uploads. So you would take your document, a Word document or a PDF, and you would upload that. So in some cases, you might want to just pull all these documents together in one place and start to upload them as you go through this process. And you can start and stop within this system as you go through the application process. Next slide. You'll be providing information about your agency, the mission and vision, any previous funding, clearly the contact information of the lead person that we'd be working with to follow up. Next slide. And some of them are text boxes that you would type in, and others, obviously, the uploads. And I think these are going to be some of the core questions that are going to be pretty relevant to be thinking about, and a little bit different, right? Again, from what we've done previously in coordinated funding. So I mentioned before, like, what role does your organization play in the safety net? Again, are you covering a geography? Are you a main provider of food to a larger system? Are you the only shelter of, or one of only a few shelters for families? Are you the only one that's addressing sort of opioid treatment or something like that? So it's figuring out how it is that you are impacting the safety net, that you're meeting one of those categories very, very clearly, or maybe serving a unique population that maybe nobody else is, or only if they are, not in the same way. So just really defining the role that you play, describing those services and the programs that would be, covered in the safety net funding, your service goals, who you're serving, how you're serving them, that could be something that's important as well. What steps you take to serve low-income communities and to address any racial or other disparities in the county. And how do you coordinate with other safety net or human services providers? Are you the only one in a region? Are you a key component in a broader system that if this piece was not funded or removed, it would impact others? Those sorts of things to be thinking about. Additionally, oh, I'm sorry, was there a question there? Hi, Commissioner, you're breaking up a little bit. Should I try again? Commissioner Jefferson, are you still there? Maybe type a question in the chat if you can. All right, we're gonna, if you are able to connect again, feel free to interrupt me or raise your hand, or if you can type a question in the chat, that would be great as well. Somehow we had you chopping up. On the submission requirements as well, we want folks to be taking a look at the county's opportunity index and seeing how that data and your own experience in serving folks in the safety net would impact how you deliver services to the community. It could be that you already are operating in very low or low opportunity areas, or maybe it's a higher opportunity area that you serve, but there's a particular group of folks that are, just heavily impacted. And for some reason, a particular population that's served, that's isolated within that high opportunity area for some reason. And there are many. So just feel free to kind of utilize that and sort of understand how that informs or what your experience is and who you're delivering the services to. There'll be questions on the demographic information on populations you serve currently. Are you, I think, Peace Neighborhood was on here, like, so how many youth are served? Where are they coming from? Those sorts of things. Other groups, whatever it is, you can sort of lay out the demographics of those you're serving. There's information around accessibility. This is related to like physical accessibility, language accessibility, et cetera, as well as providing us a budget, an overall budget of your agency, and then the budget for this particular area. And there's a template for that, which can hopefully guide you through those steps. Let's go to the next slide. I mentioned a little bit earlier that there is going to, we actually are contracting with the University of Michigan School of Social Work's Program Evaluation Group. I don't think I mentioned their name, but they're going to be serving as the evaluator for the new Human Services Partnership. So we're really excited about that. So we're not going to be asking you really for any specific outcomes related to the service delivery, the safety net services that you're going to be applying for. The intent is that once if you're selected as a grantee, that you would then work with the evaluator, review what kind of information and metrics you already collect, set some clear outcomes that we'll be able to track and report on regularly. And so the idea is that they'll be working with you to set that up. We won't be setting that standard kind of overall. They'll work with you to make the best fit, to make sure it's reporting that's an outcome tracking that is relevant to the safety net services that are being delivered, but then still are helping to inform the city and the county's leadership team about how things are going, as well as the community. I'm really excited about this. I think it's going to, obviously allow folks to kind of co-create those outcomes and those deliverables, and hopefully provide some capacity building if it's needed. Not everyone might need that assistance related to metrics and outcomes, but some agencies might. And so it'll provide a little bit more of capacity support as well. I mentioned a little bit before that the evaluator would also be working with grantees and agencies to perform an annual equity self-review. And so that'll be working with a toolkit and also some best practices and other supports related to everything. It could be anything from board makeup or how to hire more diverse workforce, or service delivery, it could be any of those components, but it would be based on a self-assessment that's done by each agency. It won't be the county or the city or the urban county saying, we need you to do X, Y, and Z. You'll be able to, again, help co-create and set those goals that would work for your agency. One other thing we did want to note within the safety net grant round, especially in light of the pandemic and the incredible, I think, I don't know, incredible demand and burden it put on a number of agencies and providers, is just this ability to pivot. So many of you did, obviously, during the pandemic. It would be something that we would be looking for you to do in case of another emergency. I hope to God we are not going to be having anything on this scale again. But we've also experienced weather emergencies and flooding, and previously like the hurricane. So I don't know what it would look like, but in some case that there's some sort of emergency response, we would be looking to the emergency or the safety net service providers to maybe assist us in some of the response activities. I would expect that, or I would think that in something like those cases, if we're looking to you to do something above and beyond, we could also be looking at additional funding, but those would be, we'd be expecting you to be some of the agency partners for that work. Just trying to think ahead a little bit. I know that's a little vague, but just based on sort of what we've faced in the pandemic, we want to make sure that if we're partnering with you, you'll be willing to partner with us even through some crazier times. Hopefully we won't have to deal with that. All right, I'm going to hand this over to Caitlin, who's going to pick this up and talk to you about the Foundant platform where you enter the grant, and then we'll pick up a bunch of those questions that came in the chat.
Okay, thank you. Foundant is it can be a little tricky. If anyone has any issues, if you haven't used it before, I know a lot of the people, a lot of the applicants that are on this session and on the Monday info session might have already been funded through coordinated funding or through United Way and might have used Foundant before. But for anyone who's new to it, please don't hesitate to email me, and I can help, send some articles that give more training, give more context to things, and I can answer some specific questions if that's needed. These are just a few tips that I wanted to highlight, that I've, received from my United Way colleagues who also use Foundant, and from some of my predecessors on some things that can go wrong. So just one thing I wanted to note, only one user for an organization can be assigned to edit an application at a certain time. So if it needs to be reassigned after you get started, you can email me and I can help with that. There's also an option to add users as collaborators. So at the top of the application, there should be a collaborate button that you can select, and you can type in the email address. I do think the person that you want to collaborate they need to already have a Foundant account. So, again, let me know if I need to create a new account for someone. I'm happy to do that and just add them to your organization. If you're not sure if your agency already has a Foundant account, just email me and I can check on that for you. We just don't want to be creating duplicate accounts. So an organization shouldn't have like 2 organization profiles. That'll get kind of complicated if you have like grant applications going with United Way and then some with our office, because we share this platform with United Way. Just to clarify that, that's why you might see United Way at the top of the website page, but our grant processes are separate. So anyways, yeah, we don't want to create any duplicate organization profiles. So email me if you're confused about that, and I can check on that for you. If you definitely haven't used Foundant before, you should be able to select the create new account button and go ahead and create your agency profile. We can add multiple users to an organization profile though, so don't worry about that. We can add more accounts to your organization's account. Okay, and yeah, any other questions about Foundant, send them to me. Okay, and then next slide. I also wanted to, this is written into the RFP as well. I just wanted to highlight this because this is important to get right and make sure you have time for all of this. To submit the application, first you'll need to fill everything in and upload all the documents you need to Foundant. And then you should be able to, after you submit it, you should be able to select application packet. There should be an option for that. And that'll allow you to download the full application. And ideally, it'll include all the documents that were uploaded and the budget and all of that. So that should be able to be downloaded as a PDF. You'll then need to send the full application packet to this email address. That's Angela Perry. She's our purchasing manager for the county. So to complete the full application process, you'll need to complete all those steps. So make sure you give yourself plenty of time. Like, don't be working in Foundant at 3:55 p.m. On April 25th. I'm just worried about being able to submit it in Foundant, download the packet, and email it to our purchasing manager. So try to get it done in Foundant, like at least like a half hour, an hour ahead of time, just in case there's any technical issues. You can email me and I can, try to help guide you in the right direction if you're not able to download the PDF or if there's any, Foundant issues. But yeah, just make sure to give yourself plenty of time in case anything does come up so we can complete all the steps. And so we can ensure your application is accepted and received correctly and on time. Okay, Teresa, back to you.
Okay, we just wanted to run through some of the timing of this, and obviously, the RFP is out there. We are collecting the questions from today. We'll be typing those up. We're also recording this and we'll be posting this on the new Human Services Partnership webpage. I think Neville might be able to drop that in the chat. We'll also post the PowerPoint. I did see that question come in as well, so you can rewatch the Zoom, maybe pull out some, if that's helpful to you, you can take a look at the PowerPoint. You can also send in any questions maybe that you have after this or you think of later through the 13th, and then we'll post the combination of the meeting questions and those that were emailed online and have that available for you to look at, so you have it at least a week before the applications are due and Foundant, which is at April 25th. As Caitlin said, it's a 4 p.m. deadline, so I just want to call that out again, so you're aware of that. And maybe aren't like me and thinking, oh, midnight. It is 4 p.m., so just be aware of that. And then we'll start reviewing them in May. These, as one thing that's similar to coordinated funding, is because there's public partners involved. Both the city, the county, and the county will have to approve them, their boards and commissions. So we'll go through that formal process. So basically at the point that we have recommendations for city council and the county board of commissioners will be able to post those recommendations. They won't be final until they vote on them, but you'll be able to see if your submission was recommended from the community reviewers to be funded by the city and the county. So just an FYI there. So that's why it has to go in the May, because we are hoping that these are approved by June, so funding can start as soon as July 1, which is at least one of our fiscal years. It might be yours. So that's when the anticipated funding would start and the start of the 5-year grants. There was a very early question around the amount of funding that was available. So this is it's fascinating because it's ever changing. So I'm going to tell you what we have now and fill you in and let you know that we kind of have a cutoff date in early May to make the final determination of the funding available. So based on the Washtenaw County, Urban County, and the City of Ann Arbor's general fund or normal allocations, I should say, we have about 2.5 million annually that's available. the city of Ann Arbor on Monday night did approve an additional, I think it's 1.6 or 1.7 of American Rescue Plan funds that will also go into coordinated funding. That, you know, we're working out how that will play with the general fund dollars. So that'll be some work that we do. The county had announced at their Wednesday night meeting that they're considering another round of American Rescue Plan funds. While they are not committed to anything, they did throw out a number of initiatives that, and what did list the New Human Services Partnership as one of them. So I can tell you that currently we have the 2.5 million annually. We have a one-time American Rescue Plan contribution of 1.6 million that likely would be broken up over multiple years, but to be determined. And then potential for additional funds to come in through the county or other partners. The leadership team has also requested that we reach out to other local units of government. So we're having conversations with, we met with Ypsi Township, we'll be meeting, we met with Pittsfield Township, we've met with a number of jurisdictions. I don't know if that will result in additional funding or not, but all of this is happening right now. And by early May, we should have a final determination on the funds that are available. And then we'll be splitting them with a, you know, kind of a percentage split for the 3 different funding rounds. So that is as detailed as I can be. I hope that as we have that worked out, we'll post it on the webpage as well so that you can track that. So I know that's a consideration for you all. I'm sorry, it is ever changing. So want to let you know what we absolutely have right now. And then if there is additional funding that has been made available, we'll make sure to note that on the web page. All right, I know there's quite a few more questions in here, so let me make my way through them to the best of my ability. And hopefully I'll get to all of them and then we can take some more as well. Oh, Caitlin, will Foundit save basic info if you have an account for when you apply for other grants?
So is the question, like, if you apply for a different RFP in Foundant, will that information copy over to this process? I don't think so. Your organization profile stays the same, but if it's a separate process, it's a separate RFP in Foundant, then we'll have all new questions that will need to be filled in separately from what you've done before.
Okay, thanks. Are there income thresholds for financial documentation audit flexible? As a child care provider, we operate on a break-even budget and audits would take away from the scholarship. So yes, Caitlin, do you recall what the thresholds are for the, this was an addendum that we did put into the RFP. We can drop that link in here in just a moment as well. But basically there's different, you only require an audit if your annual budget is it over 500,000? Caitlin, can you confirm that one for me?
Yeah, let me go back to that.
Okay.
So we're requiring an independent audit if the annual total revenue is 500,000 or more. And then if it's below 500,000, we prefer it, but there's other options.
So
Right.
if we need to pursue those other options, do we just move forward or do we need to get more information from you all?
Oh, well, the other options are also listed on the addendum.
So bottom
so-
line is if your income, it doesn't matter what your bottom line is, right? Like if your income, regardless of what the income stream is over 5, then you need an audit, period. It's
Correct.
okay.
Yeah.
And we'll grab that addendum and and drop that in there. So you can see those breakdowns and what those options are. See if I can get that.
So I just dropped in the link to the county open bids page.
Thank you.
So everyone feel free to use that link. And then once you get to the page, well, our RFP is the only one open right now, but it is bid number 8311. And then click on the additional documents section, and that'll take you to the RFP document and then the 2 addenda that we've posted.
Thank you, Caitlin. So a few more questions in the chat I'm going to try and pick up. I realized I jumped around, so I'm going to, hopefully I'll catch them all for some reason. If I get through them and I've missed yours, please let me know. So mention, and I understand that this is not super perfectly clean. This is the first time we're doing it, but for these safety net services that we're talking about in the 4 program areas, obviously if you're someone who is countywide, that would absolutely be that, but you could also be the only sort of safety net provider or one of just a few in a particular area geographically or in a particular service type. So I just want you to think about that question of like your role in the safety net is really the most important one. And that applies to what those services are, but also those income thresholds. So there was another question around Meals on Wheels programs where income's not the factor as much as people being medically homebound, right? So if you are like one of the only providers that are doing that work, and if it is not provided, then it's a basic safety net need about emergency or, food security is not met. I think that is the case that you would make in that particular example. So I can't probably answer all these individually. And also there will be a committee that's reviewing them. So just a caveat there, but it's going to be very important to sort of define your role within the safety net around foods, emergency food access, around housing and homelessness, around that childcare provision, around those medical services. So I'll try and see if I can help you with any more examples, but to whatever extent, try and be as clear as you can about the necessity of your services to, the broader safety net. I think that's going to be key and how folks are able to review and understand your role within it. Okay. Let me see if I can catch a few more of these. Is homelessness prevention through supportive housing case management eligible for funding? So permanent supportive housing, if that is absolutely listed in rapid rehousing services, those include case management services. So I think that's what you're mentioning, Kathy. Is that appropriate? I'm going back to your question there.
Thanks, Teresa. I appreciate it. I'm wondering about folks who are housed, but they need case management to retain their current housing.
Right. Yeah, I would say yes, because that is like the permanent supportive housing model is for folks who are currently housed and there's more intensive services so they can maintain it. So I think we're talking about a similar thing. So
okay, wonderful. Thank you.
Katie, I see you're clarifying this is Port Path. So thank you for that. Maybe we can check in offline around the county department question. Are organizations that have applied for 513 status but have not yet heard back from the IRS eligible to apply? So great question. That's a new one. I would say let us know that you have applied for it, and if because this will take a little while, and maybe if you have an expected time frame from when you would hear back, I would think that we would at the points. So say you would be someone who was selected. I don't think it would, if you've applied for it, I think you would be eligible to your first question. And if for some reason we're getting to the point of contracting, you haven't received that status yet, we might ask you to partner with another nonprofit as a fiscal agent. But I would not let that discourage you from applying. If you're a new org and you don't have an audit or 990, please indicate that. So that'll just let us know that you have not received it previously. And I will say though, in this particular funding round, we are looking for folks that are experienced in that service delivery. You might be as a new org, having worked somewhere else and maybe shifted to a new nonprofit, but we are looking for experienced providers here. If you're new in the service delivery area, the mini grants might be a better fit for you, but I don't know this individual case. So just things to think about as you look at whether or not you want to apply for this funding round or a different one. The grant monitoring documents that are needed, I would say if you have had a grant monitoring, There, at some point, you would have received a document saying if you had findings or not, or if you were cleared after review of the monitoring. So those would be the kinds of things that we'd be looking for. If you've never had a grant monitoring, you can, or you have not had one in the time period we asked for, just indicate that you haven't. And this won't apply to everyone. So this, if you have, we'll be looking for that. If you haven't, then just let us know that. Do you work with the housing services program evaluator before or after the grant? So you would start working with them after you would receive funding, both on the equity self-assessment and then also setting up those data, sort of the metrics and outcomes that you would be reporting on over time, over the course of the 5-year grant. So none of that would have to happen prior. There are 2 questions in there in the application related to sort of your experience with equity and also with data, but they're not scored. It's just more informational that we could share with the evaluator should you be selected as a grantee. So you'll see those as you're in filling out the application and found it. Are the county's new resettled refugees an eligible population for the funding in the 4 areas? So, you know, we're not saying any population is eligible or not. We're just asking what populations that you're serving. It's whether or not you're doing the safety net services in one of those 4 categories. And skipping down a little bit more. Yes, we will. Oh, will the PowerPoint be sent out? We're definitely going to post it. We can also send it out if people would like to see it to folks who had registered and give you a link to the webpage as well. Let's see. I think I answered that one. Will the slides be uploaded to the site? Yes, we will make sure to upload the slides, and we're also recording this. So we will be posting the recording as well. Is there an indirect rate that's allowed in the budget? I didn't see a line item in the expenses for this. So we are, these particular grants, this funding round is operational support. And so we're not necessarily asking you to, you know, so there's not like an indirect rate. We want to have a sense of your budget overall and sort of what's being supported. But we won't need anything that specific. I think I made it through the chat questions. What other questions do you have today? Any question? I know there's questions. Can you apply for the safety net and the mini grant? Just popped up. Yes, we haven't set any distinctions or about people doing one or the other. I would also think that people maybe who apply for the safety net might have a new idea they want to try out outside of doing sort of the basic safety net service delivery. So yes, you would be able to apply for 2 different funding rounds. I will say that we do know in the RFP that you can only apply in one funding area, and that is because we're looking for you to providing that main safety net service. So you would have to explain if there's something above and beyond, again, in your role in the safety net. I think there was an earlier question about, can I apply in more than one funding area? You can only select one. So it's either housing and homelessness, it's either emergency food service or emergency food system, the childcare, or the healthcare one. Is the budget template just intended to break down year 1 and years 2 to 5 should be explained in the budget narrative? I think we are sort of making an assumption here that since you'd be getting steady funding from us, that it would be similar each of the 5 years. So I guess if you'd like to explain that in the budget narrative for years 2 to 5, especially if there's any changes that you're expecting, that would be appropriate. That's a good question. Thank you. These are all good questions. I shouldn't just say it's Courtney. Thank you all for these excellent questions. Will you have info sessions before the mini grant and the fall systems change grant? Absolutely. Basically what we're doing now with having more intensive information available, we would do for both of those funding rounds for certain. For agencies that provide safety net services in more than one of the 4 areas, any advice on how to choose just one? I feel like that's a trick question. No, I don't. This is our first time doing this, and I think that we're all feeling a little bit of that discomfort of not knowing all the details of it. So I appreciate you all being pretty patient as we work through this. I think it's wherever you can make your best case, right? Where you feel the strongest, where your role is the strongest within the safety net is where I would suggest going, that you can make the strongest case for yourself and your agency, is where I would put in your application. Any other questions? Commissioner Jefferson is sorry he had a bad connection. He was just letting us know he was there, since he is one of the folks on the leadership team. So sorry about that, Commissioner Jefferson. Hope you were able to still hear us to some extent.
Teresa, I'm not typing fast enough. I'm afraid we'll get cut off, but one quick question. I know that the county probably doesn't have the capacity to have a bunch of our nonprofits pitch ideas to determine which funding source we may better fit within, whether it's the safety net or the high impact grants. So we'll just kind of have to do our best, but is there the ability to say, this is what we're looking to apply for? Which opportunity do you think we fit best within?
Yeah, I think so. Yeah, if one thing is, if you're not clearly in one of those 4 areas, very strongly, I would say you're probably going to be a better fit in the mini grant or the high impact areas. And I will say that, this is the only time, the safety net is the only time we've prescribed 4 like sort of key areas: the housing, the homelessness, the food system, the childcare, and the healthcare access. And the other ones, if you are working in the areas where you're addressing poverty, racism, trauma, then you're going to fit, right? You just will be making the case either in the mini grant round or the high impact round about kind of what you want to do and what you want to try in the case of the mini grant, and who you want to serve in the case of the high impact grant. So if you don't feel like you're strongly falling in one of those 4 categories, I think that's probably the best indicator to look at one of those future funding rounds.
Great, thank you.
I hear a lot of you trying, and I understand why. And I would do the exact same thing. Like we do these things. They're part of the bigger picture of what we do. But if they're not sort of the bread and butter of the operation, it might not be the right fit. The other ones might be. Can you share grant ranges for other grants? Yes. I'm trying to look. So the high impact grants are going to be similar in that we're looking to do a $200,000 to $300,000 commitment. I think actually 300,000 is what we send for the high impact grants. And in the mini grants, we're looking sort of in the $30,000 to $50,000 range, because they are the smaller grants and also a limited, 1 year kind of exploration. So that's generally, obviously I haven't pinpointed that mini grant number, but we'll have that finalized obviously before we release that this summer, but that's generally the range for those other ones. I will say for the high impact grants, we're probably only expecting a smaller number of grantees because it is a lot of work. It's a big commitment to really commit to delivering those outcomes. I think many of you probably will be poised for that, but it is a lot of work. But we would expect a higher number of applications in that mini grant because it'll be a simpler application. It'll be trying things out. Less of a commitment on your end to sort of having that exploration. But if things go well, we also want to find out potentially a way to maybe continue that funding for folks. Like, that's the point. If it's successful and you try out a new idea and things go well, we want to see how we can continue to support that. This is one of those times I'm like, should we have had more time? You guys have excellent questions. Oh, is the DEI self-assessment for grantees expected to take place before or during the grant period? Thanks for clarifying. So if you are selected as a grantee after we go under contract, then you would do the self-assessment with the evaluator. So both the self-assessment and the outcome development would happen after you were selected and to be a grantee, not before. Right. Any last questions here today? Oh, there we go. We got one more. Way to get one in under the wire. Will, oh, whoops, I did something and I lost it. Will these be the only grant opportunities offered for the next 5 years? So the safety net grant is meant to be 5 years. The mini grants will be annual. Every single year we'll be running a mini grant round, and the high impact funds will be for 5 years. I don't know, like there's one of the things that I'm wondering, because again, this is our first time around and many of you are watching, so many different funding rounds happen right now, right? United Way has 2 funding rounds out right now. St. Joe's did a funding round. Even the county put out their community priority fund that many of you probably applied for that's due today. So for both the safety net and for the high impact, it might be the only time, but I'm also hopeful that maybe we would have additional partners and the ability to do an additional funding round. But I do think for right now, I can only say that the only additional funding rounds we would have would be the annual mini grant ones. Here's a question that came in. This is considered federal funding and contracted as such. The Washtenaw Urban County dollars are the only federal funds. That it's approximately about $300,000 that would likely go to in the housing and homelessness section because of eligibility requirements within that particular funding stream. The rest of them are general fund dollars, so they do not have the same federal reporting requirements. The reporting requirements will be the ones that we work with the outside evaluator in establishing. A lot of it will be about services delivered, demographics of people you deliver to, but there'll be other outcomes that you'll co-create with the evaluator and report on regularly. Can I repeat the date? The recording will be available on the website. I don't know if I said that, but I think if we can get it up today, we'll try to. If not, we'll have it online on Monday. Thanks, Alex. Glad you were here. And thank you all for being here. And I know there'll be more questions that come up. So again, maybe Caitlin, can you drop your email address in the chat? Please send any additional questions to Caitlin. And then we do have another info session coming up next week. Feel free to come again, watch the Zoom, however works best for you. And yeah, thank you so much. These were excellent questions. And I want to also thank you all for your patience as we've developed this new human services partnership. Appreciate you all going through this with us. So thanks everybody and have a great weekend.
Thank you very much.